problems in childhood are more mysterious and confusing than ADHD. Indeed, I once had a mom challenge, if Huckleberry Finn were alive today, would we slap an ADHD diagnosis on him and pump him full of drugs? So there's a lot to understand about ADHD. Hello, my name is Dr. David Palmer. I'm a professor of psychology and counseling here at Marywood. On today's edition of Mental Health Matter, we're going to look at all matters containing ADHD or dealing with ADHD. I'd like to begin by introducing my very experienced panel. To my immediate left is Dr. Carl Schuster. Dr. Schuster is in private practice in Peckville and also adjunct faculty at the University of Scranton. Dr. Schuster has also been a guest on this program for more than 12 years or so. Next to Dr. Schuster is Dr. Amanda Luchansky. Dr. Luchansky is in full-time private practice in Clark Summit, is an alum here of our PsyD program, and is also a member of our adjunct faculty. Next to Dr. Luchansky is Ms. Nina Grushinsky. Ms. Grushinsky is one of our shining undergraduate psychology majors here at Marywood. And on the very end is Dr. Stuart Badner. Dr. Badner is an associate professor of practice, a school psychologist, and on our faculty here at Marywood. Welcome, everybody. So we have a half hour to talk about a very complicated topic. Let's begin by having you guys describe for people watching what there's two clusters of symptoms with ADHD. Let's talk about the first one. What do the symptoms of attention and concentration look like, and what are they not?
Well, I think the most common thing that you would look for is a child that has trouble sustaining their efforts on things that they need to do. And that's often why school age is one of the first to see that, but that's a big symptom. And along with that, distractibility. So you're asking the child to do something that they need to sustain their focus on, and they get distracted by something else, and it takes a long time to finish something that should have taken maybe 10 minutes, takes a half hour.
One of the issues I see in working with teens and young adults is an issue with motivation. They have a desire to do these tasks, but they just can't seem to get started, or they'll start it and then they're like, I don't know where I drifted off. I somehow ended up doing something completely unrelated. So that's one of the things that I see the most as being a point of frustration for those.
So how, what a fever is in a pediatric practice, attention problems are in a psychology practice. That there's so many different things that cause it. There's a problem in there somewhere. There could be a variety of things. So how do you differentiate attention problems that are affiliated with ADHD as opposed to stress or anxiety or any of the other causes?
Well, one of the things I always talk about with families is we talk about across multiple settings. So is this something that you just see at home, or are they seeing it at school? Are they seeing it at soccer or some kind of activity? Usually if it's a more ADHD related problem, you're going to see it across multiple settings, and that's one of the tip-offs that it's more likely to be that type of problem. Then also over time too. You mentioned, like, if it's a stressor, person may be distracted, upset because of a recent stressor. And if you can identify that and say, oh, well, there was a death in the family or something, okay, that might be the reason. But if it's been a long-standing thing, more than 6 months at least, then you would say, okay, again, that's another factor in the favor of ADHD.
One of the things that we see in the schools are alternative possibilities for ADHD type behavior. And one of the things we want to look at, are there any learning problems happening here? As Carl mentioned, we want to look at multiple settings as well within the school. So various classrooms, and also contact family and see if we're seeing that behavior at home as well.
Well, last question about attention, and we'll go to the other. Sometimes hear parents challenge you, telling me my kid's got ADHD, he can play World of Warcraft for hours and attend quite fine. How do you reply to a challenge?
Well, usually what I say is, think about the task that your child really likes. It's interesting. It's inherently interesting to them. It's entertaining. Often, whether it's a video game or something like that, they've spent millions of dollars to make it engaging. And so, that's why your child can sustain that, because that's providing the stimulation and the excitement for them. And it's really more, where you need your sustained attention is when it's not a $1 million video game trying to keep your attention. It's when you have to provide the attention to a task.
All right, so let's move on to the second cluster, impulsivity slash hyperactivity. What can you describe for our viewers what that?
Well, it's probably the easiest one to notice, especially for parents and teachers, and that's the child that has trouble sitting still, that gets out of their seat, that's talking to their neighbor, that's calling out when the teacher's asking a question and they don't raise their hand. They may be excited, they know the answer, they impulsively blurt things out. Those types of things you would look for on a pretty regular basis.
So we can have one of those clusters, we can have both of them together. I think for most of this program, we're probably talking about the kids that have both together, unless we explicitly say so. Which, Nina, you have some numbers about how common ADHD is.
Yes, it is much more common among young boys and males than it is among females, being males were 15% and then women were roughly 7%.
So there's a sex difference there. What a lot of people wonder, what causes ADHD? Do I need diet? I mean, do I have to be nicer and parents? I mean, what causes ADHD?
So one of the things I explain to families when we are, if that's the diagnosis and we're going over a treatment plan, is I explain that it's a neurologically based disorder, that this is a difference in number of studies have shown difference in brain metabolism in certain areas, and that it's not anything anybody's doing on purpose, but it's has a neurological underlying aspect to it. And I think that often is a relief to the parents that, like you said, might be worried about, did we do something wrong, or are we not handling this right? It often is helpful for them to understand that no, there's a good deal of research that shows there's neurological underpinnings.
Mm-hmm. So most of the time, genetic, inherited. Would be the fact that sometimes some toxins entering the brain in utero and head injuries, but mostly it's.
Yeah, there's some research also talks about the environment as well could impact that combination of both the genetic predispositions as well as environmental stressors and learning styles, things like that can impact development.
So parents probably hear the term executive. What's that referencing regarding ADHD?
I kind of describe it to people as that's sort of like our control center. That's really what allows us to do so much that we do on a daily basis. Take in information, hold that information, kind of figure out what we need to do. One of the things that we talk about is, I often use the example of a conversation. When you're having a conversation with someone, you need to remember what you're talking about, think about what the person is saying, and then think about your response and the appropriateness of the setting. That's a whole lot going on, for anyone at any point in time, but for individuals who have issues with executive functioning, that could just be a little too much. It comes in and it may quickly, leave. So trying to help them understand that, it's very complex, and it's not something that you could just say, focus, because, there's an issue.
So what are some common co-occurring problems that exist with?
Well, I think one of them that you often will see is sometimes kids will be described as being oppositional or defiant. And, again, I think it's important, obviously, to thoroughly evaluate the ADHD part, because sometimes that may be the larger part of it, but some kids also have an approach, and maybe this is, again, temperament-based, but they have a hard time following rules and listening to authority and being, respectful in terms of their responses, and they end up in a sort of regular conflict with not only with adults, but with their peers as well. So that sometimes is, and that's certainly something you'd want to watch out.
Depression, and anxiety as being two major co-occurring disorders, because I think the person, the child or young adult, feels down because they, recognize that there's something different or they're not meeting expectations. A young child may notice that they get in trouble more at school than their peers. And children tend to internalize that. And, as we go through adolescence, we're very sensitive to how we are with our peers. And then they may also become anxious when asked to perform.
And we also see learning problems associated with ADHD as well as the oppositional defiance, conduct disorder issues. But definitely we do see quite a bit of learning problems associated.
That actually is a nice segue into my next question about, so we're talking about this as a complicated disorder, and sometimes it has complicated co-occurring problems. So what are some evaluation methods that you find useful for teasing all this out?
Well, I mean, one of the things I always start with is some rating scales for both the parents, if the child's old enough for them to fill out, and if you can, parents consent to it for their teachers to fill out, so that we get a broad view of how people are viewing things. And these rating scales, I try to use a couple so that we get a wide range of not just looking at just ADHD symptoms, even though that may be what we suspect, but also ones that ask about oppositional behaviors, anxiety, depression. I think that's an important first step. And then if it does seem as though attention is the main issue, I have found direct testing of their attention with one of the computerized continuous performance tests to be very helpful as well in narrowing down, because you get to both observe the child do this task, and you get to look at the results and see how did you perform on something that asked you to pay attention and control your impulses for a set amount of time, and take a look at that in comparison to the norms for your age.
So help people, 'cause I know a lot of people don't know when we say rating scales, how come that's helpful? What are rating scales about? How do we use?
Well, the rating scales are, as Carl mentioned, there's two kinds. There's narrow band, and which is more specific to the ADHD symptomology, and there'd be more broadband, which encompasses the more of a wide range of mental health symptoms or issues. So it's important to look at both. You don't want to just look at one piece of information. I'll also say in a school setting, we look at a variety of factors, not just the rating scales, but also observation. Observation is a very powerful tool from parents, from multiple teachers, their assessment, as well as the evaluator going in and observing that student in multiple settings. So now we're getting a very broad-based view of what that student is doing in that individual setting. Sometimes it's the setting itself that could create distractions for that student, which creates more of that symptomology, sometimes not.
Mm-hmm.
So we're evaluating all of that. We also want to look at, especially in a school setting, if there's any questions regarding academics. We want to see how their cognitive ability is, as well as their academic achievement. So we generally...
The testing's coming up here in a minute.
Yeah.
Before we get too far from the first two, so with rating scales, we use things called norms. Can you guys tell our viewers what norms are and how they're relevant evaluation?
So, I mean, what I explain to parents is when they're filling this out, their responses are going to be compared to a large database that's been gathered of other parents of kids in the same age range who completed the same measure. And then we can see from the norms are, again, a large collection of hopefully randomly sampled parents throughout the country. It allows you to compare, well, okay, what's typical for a child based on what most parents are seeing at this age, and what kind of things might be atypical, might be a concern. And so it allows us that nice comparison to what are most parents seeing, and what is your child displaying based on your view.
So you need that symptom expression at the 93rd percentile for the same age range and gender.
Mm-hmm.
So that's significant. I mean, this is not something given willy-nilly if a kid's having a bad quarter. I mean, you really have to have a significant level of expression 93rd percentile for at least 6 months.
Right.
And then Dr. Schuster also mentioned sometimes there's computerized testing. Can you guys say a little more about what might be involved with something?
So the computerized testing focuses on typically a simple task where the child is asked to respond to a certain stimulus and not respond to others. And then it measures, as the child's doing that, are they missing the thing they're supposed to be responding to? Are they hitting a lot of the things they're not supposed to be responding to? How consistent is their attention to that task over time? And once again, that's normed as well. So their performance is going to be compared on that same computer test to the norms that were developed to make that. So it gives you another piece of information.
Purposefully boring, quite the
Right.
opposite of
Right.
a video
Of a
game.
video. Absolutely.
So, and then as you started to talk about, Dr. Badner, sometimes it's important to rule out learning disabilities, which then gets into education. Can you summarize for people what that looks like?
Sure. As I mentioned, we certainly look at the behavior scales, observation across multiple settings. And then we also are going to administer standardized cognitive ability testing as well as academic achievement testing, as well as review all the various records that the school has compiled in terms of their reading skills, their math skills, comparing them to other students within this particular district that the school student is in, as well as across the state. So we have multiple pieces of data that we look at when we're ruling out things like learning disabilities, and especially if we're looking at things such as ADHD as well.
So, and I don't want to get you in any trouble, but I am interested in your comment on this. I find the quality control of educational testing is quite variable. So if you were a parent, what kind of things would you want to see be in a decent education?
Well, I would want to see a review of the child's records, first and foremost, having the parent involved with the process through their informed consent, so they understand exactly what's going to be happening with the evaluation process. I would want to see the school having been making efforts and seeing what those efforts and being included in those efforts while that student is involved with their general education curriculum, and see if they have been involved with any kind of pre-referral process for evaluation, sometimes known as the child study team, where usually that team works with that child's teacher or teachers and help remediate any learning concerns or behavioral concerns in that general education classroom. So all of that data is going to be prevalent for that child, and as an evaluator, I'm going to want to have access to that and include that in my report as well, beyond whatever standardized testing that I do.
So let's segue and talk some about treatment. We'd need a whole hour to cover it adequately, but what are some high points for treatment plans for children that we're talking?
Well, I think one of the things I often discuss with parents, if it's obviously, the child clearly meets criteria for ADHD, it's having a functional impact in their day-to-day life, then we talk about medication. Because as we mentioned a little while ago, it's a neurologically based problem. There are many medications that can be very effective in helping to remediate a lot of the symptoms. And again, that's where your baseline testing is really helpful too. If you've done rating scales in the CPT at the beginning, after they've been on medicine for a while, you can use those things to help you gauge how well is this working. Are we seeing the changes you want to see? And again, usually, most commonly that I see prescribed by most pediatricians and child psychiatrists is something in the long-acting stimulant family is usually that type of medication.
Well, the parent listening would go, well, stimulant, wait, he's hyper. Why do you want to stimulate him more? What would you say?
Go ahead.
Oh, no,
Usually what I say is, well, when we're talking about understimulation, right? This is a problem of the person being understimulated in areas that are related to like impulse control, attention. And so if we stimulate those areas properly with medication, then you're going to see a lot less of those problems. It's a little bit counterintuitive, but when you kind of sit down and explain to them where the basis of the disorder is, how the medications are designed to work, they kind of then get the idea, okay.
Nina, you came across some research talking about working with kids about their attitudes regarding medication. Want to share what you learned?
So it is really important for children to have an idea or an understanding of why they're taking this medication. We also want them to feel like they can recognize things in themselves that, hey, I don't like when I'm not paying attention in class, and, I want to focus, but I just can't. And if they're able to recognize that and realize that I'm not taking this medication so that I'm more tolerable to other people, that people, that I'm behaving good, I'm taking this medication to benefit myself, and that they're not seeing themselves as a bother to other people that needs to be, taken care of.
Very true. So what about behavioral intervention? What do those look like?
A lot of times I think it helps to have a discussion about how they're presenting demands to their children. If somebody's struggling with attention and you rattle off a list of 10 things for them to do, maybe they'll get 1 or 2 done, but they're not going to remember everything. And also, we've talked a little bit about how motivation can be a factor with ADHD. If the task is too large, it may be overwhelming. So I usually encourage people to try to, I always say chunk it, break things down, keep things small and simple, and don't forget to praise, the positive behaviors that we see. These children are often being told about everything that they're wrong, but we also want to remind them that you're doing a whole lot right.
Just to add to that, there's a old rule of thumb about for every reprimand you give 5 praises. So you want to emphasize the positive, and you're so right.
Ratio.
A lot of times the kiddos with ADHD are don't do this, don't do that. They're constantly being prompted, or in a school setting, there's some really nice curriculums that are out there now, which many schools are making use of, and such as the zones of regulation. It's one that I know we implemented over a number of years, and as a result of that curriculum, which teaches self-regulation skills and self-monitoring skills to children and adolescents, we see dramatic decreases in discipline referrals and increasing academic performance. Just by getting them involved with the process. And it's not just the children that are learning these skills, but it's the teachers, everyone in the school, if it becomes school-wide, becomes involved. It creates a common language. So now children are being reinforced by multiple adults, by their peers. They practice role-playing, and we can do that at multiple levels, depending on the general education population, all the way up to individual needs, where we can really manage that individually. So there's a lot of really cool things that schools can do as well. So yeah.
So what about the anxiety and depression you mentioned?
One of the things that I try to help people focus are things that they're proud of, things that they do and they do well. Maybe sitting in a classroom is difficult for a child, but maybe they're very creative. Trying to foster a sense of, self-efficacy, that I I may have a tough time here, but I'm really good at this. You know, and helping the child, you know, change how they talk to, you know, themselves about what they're doing. Oftentimes, if we listen to kids, you know, they'll say some unkind things, you know, like, oh, I did it again, or that was really stupid. And trying to help them, you know, learn to say like, oh, you know, I made a mistake, or I'm going to try harder next. You know, I find that if we start to pay attention to those little to change them, we can start to improve how we.
What about cognitive behavioral therapy for some of those anxiety and depression? You guys just give a headline on what is entailed with.
Well, I think a big part you'd want to focus on with kids is along the lines of what you're saying. I often talk to kids about, like, what is your self-talk? What's the messages that you're giving yourself on a day-to-day basis? And, you know, what kind of things maybe that you're saying to yourself that are making things harder, more stressful, more difficult than they need to be. And then let's learn how to recognize that and change it, and change the message. And you change the message for yourself, it starts to affect how you feel, how you behave. And so one of the things I find helpful is trying to help them to link together the idea that their behavior and their feelings don't just come out of nowhere, that they're all connected to their thoughts, their beliefs, there's an interaction there. And if you can use some, you know, practical examples from the kids, oftentimes we'll ask kids to, you know, write down in between visits what, you know, they were thinking or feeling when certain, you know, stressful things happen. And then we kind of look at then how do we connect with it? And that can make a big difference in terms of learning how to manage your own mood and stress level.
So we just have a couple of minutes left, and let me ask you each, if you could instill in the public one fact or get people not to believe one myth, what thing would you want to have people understand about ADHD?
Well, I would say one that I often hear is, you know, that it's bad parenting, or if you were just more of a disciplinarian, you know, from other parents will say other parents have said that to them. And that's clearly a myth that I you know, it's not bad parenting that's causing this. This has a neurological, you know, underpinning to it. It's not, you know, there's certainly things you can learn to do differently to manage it better, but that's not the cause.
Good one. What else you guys got?
I would say it's, I know there's been a lot of programs out there about rewarding positive behavior and shaping behavior, and but what we really find helpful is including the children with what's going on, educating them about what's happening with them, and helping them see different ways of being, and have them practice that. And that seems to help make a difference.
For the importance of collaborating with children.
Absolutely.
You know, I think one of the things that's important to remember is that there's no pill that's going to completely rid you of these issues. I find in the clinical setting that many people would like that to be the case. But, you know, this is a complex neurological issue. It's not going to just be addressed with medication. You know, and I think that individuals have the best outcome, you know, when everybody sort of rallies around them. So, you know, this isn't just, you know, little like Mary or problem. You know, that the environment makes a huge, and it's going to take a multifaceted approach.
Research very much bears that out, that kids that just get medication do not do as well as kids that get some of the other things you're describing. Anything you'd like to?
I just think it's very important to practice patience, that you're speaking to somebody who is a person experiencing ADHD. You're not speaking to ADHD. This is a person who suffers with this thing. And just recognizing their individuality, words.
Gotcha.
But recognizing them as a person and not as their disorder.
Thank you. Thank you all for making the time to be here this morning.
Thank you.
That's it for this edition of Mental Health Matters. Please look for our next edition in April, which will regard family dynamics. Until then, please do remember mental health matters.